BBC News.
Joining me now from Leeds is Rob Webster, who's Chief Executive of the NHS Confederation, which represents managers and health trusts. A very good morning to you and thanks for your time today. Lord Carter there in Hugh's report saying delivering these savings is going to be a challenge. How big of a challenge?
Well, this is a very powerful report which has some strong messages for government and for the NHS. And if it's going to be delivered, both need to listen and pay attention. For government and the arm's length bodies, what he says quite clearly is you need to help support a single version of the truth rather than the multiple requests that you have for information from the NHS at the moment, and you had to provide a joined up way of supporting the delivery of these savings. I think that's essential if NHS leaders are going to respond and deliver the £5 billion that's set out in the report.
With the greatest of respect to Lord Carter's report, and he's pulled lots of aspects of this together, we have heard all of this before in a way, haven't we? So what is blocking change? What is blocking ways of finding efficiencies and saving this money?
One of the things that the report does very well, I think, is draw on the experiences and the insights from NHS trusts. And what we've quite clearly been able to show is that there's not been a way of benchmarking or sharing information across the service. There hasn't been a single way of supporting improvement and sharing best practices in the service. And by focusing on the 15 recommendations in the report with direct support from national bodies, there's a chance that we can achieve the improvements that it sets out.
Is it a one plan works for all approach then, do you think? Because individual hospitals in this have their individuals' savings targets, but from what you were saying, it sounds like you think there should be a template, a plan for everyone to work to.
Well, it's certainly a coordinated effort and a shared effort, and what Pat Carter talks about very clearly is a single version of the truth and a single set of support that's available to trusts. That doesn't exist at the moment, and until we have that, benchmarking between different organisations and learning from each other is difficult, as is driving combined shared savings through procurement. We can do this though, and I think NHS leaders have responded very positively to the report in that context. And we need a response which is joined up from government and from the front line. And we're very happy to support that. What we're calling on is for the government and the arm's length bodies to respond in exactly the same way.
Let's just pick out one of the things from Lord Carter's report, the drugs bill. He says another £1 billion could be saved by the health service in England. Just talk to us in a little bit more detail about that and how you see those savings being made and what's being done now that should be done differently.
Again, it comes back to what kind of intelligence do you have around the use of drugs in the NHS, and how do you ensure that you're using the cheapest and most effective version of drugs. As they come off patent and you can have a branded generic or a generic drug which is exactly the same compound but much cheaper, how do you make sure that we're buying that at the right price and that we're all using it? So it comes back again to shared intelligence and procurement en masse of drugs which are clinically and cost effective and used across the service. Over the last 10 years we've had a situation where organisations have been more encouraged to look at themselves in isolation. The future is all about collaboration, sharing of data and using our purchasing power to deliver more cost effective treatments for patients.
And just very briefly, finally, that 900 million that Lord Carter identifies could be saved by getting people out of hospital fast. I mean, that's certainly one of the stories that we've heard over and over again, using that horrible phrase, bed blocking. But that for me seems to highlight that, you know, hospitals alone can't deliver that sort of change, can they?
That's the biggest single message in this report. If you look at delayed transfers of care, we've got people who are stuck in hospital, which is not good for them and not good for the NHS. And the reason for that is because we're not looking at the whole system and there's been a reduction in social care budgets. So staring us clear in the face is the fact that there's been a 31% increase in delayed transfers of care from hospital to home because of social care issues, and that's directly related to cuts in social care budgets. If we don't deal with that and we continue to cut social care, then it's the NHS that bleeds.
Okay, Rob Webster, Chief Executive of the NHS Confederation, thank you very much.
Thank you.